Good afternoon, everybody. Welcome to our weekly update that we do to provide some basic information and share local updates in the Chippewa Valley related to COVID-19. We're really glad you again joined us, and thanks to the media for being with us. This is our time that we also answer media questions, and we'll do those at the end like we usually do. If any members of the media do have questions that they'd like to put in the chat box, you can certainly do that, and Audrey's with us again to share those questions, and we'll respond to those at the end. You'll also be able to unmute at the very end if you have questions that you want to ask verbally by the media. So today is April 29th. It is hard to believe that we're at the end of the month. I understand it's very nice weather outside, so that does get us starting thinking about the fact that summer's coming, and we're all excited about that. Today, I'll go through some of our basic data, some basic information. I'll share that with you first, and we have two special guests with us today, so I'll be welcoming them to share some of their perspectives about COVID-19 and particularly about vaccination, and then I'll share some final pieces before we get to the questions. So first of all, our daily update of data, and this is really our data that we make available to you every week. We now have 11,459 individuals that are Eau Claire County residents that have tested positive for COVID-19, 44 more people since last week, Thursday, when we shared that with you last. An average of about 6 cases a day. We have 74 Eau Claire County residents that are active cases, meaning that they're staying home so that they don't spread COVID-19 to others. We're working with those people as well as their close contacts to make sure that we continue to keep disease spread as low as possible. 393 people in Eau Claire have been hospitalized related to COVID-19, 2 more people since last week, Thursday, and we now have 108 Eau Claire County residents that have died related to COVID-19, an increase of 2 more people since last week, Thursday. And an important reminder that that's an impact like no other on family, friends, neighbors, and our community as a whole to have that happen. We also share a bit about weekly data that we have available to us. Our UW Eau Claire connected cases remain about 13% of our total cases since the beginning of September. We have 5 active public health investigations happening in Eau Claire County, none in our long-term care or education settings. So that's good news that those 2 settings right now do not have any active public health investigations, and that's really great progress for our community. Vaccine has really helped, especially in those long-term care settings, to make that happen. Our state rating for COVID-19 activity level remains high. We have 96 cases in the past 2 weeks with a flat trajectory. Again, we're hoping to get out of that high level of activity in Eau Claire County soon. We have to work together on that. That is related to getting lower case numbers happening in this community for a sustained amount of time. Our positivity rate is at 4.4%. It's been in that 3 to 4% over the last number of weeks, and testing has been relatively flat. About 216 tests per day for COVID-19 have been done. Our hospital bed capacity remains really strong, as does our public health capacity, and those are also really important for us in how we make sure that we don't have disease spread happening quickly. Our community spread measure is still in the red. That's at 47%. And just a reminder that that is a measure of the people that get COVID-19 in our community, how many of them know where they got it from. So again, about 47% of our cases do not know where they got COVID-19 from. And we are now in that green level for the data that we track weekly for vaccination, again, meaning that there are immediate appointments available across the community for COVID-19. It's hard to believe that a month ago, less than a month ago, we were really worried about having enough vaccine available, and that production has increased, and we do have vaccine available in this community. So that's now at the green level. For those of you that are tracking data, please do know that you can go to our website, and there is a wealth of data on that site. There's also a wealth of data at the state COVID-19 website as well. So now I'll introduce our guests. And first we have with us True Vu. True is the lead organizer for the Black and Brown Women Power Coalition here in the Eau Claire area. She's also a member of the Eau Claire County COVID-19 Vulnerable Populations Working Group. That's a group that's been working throughout the pandemic to really focus on how do we support success broadly with preventing disease, with testing, with vaccination in parts of our population in our county that have barriers, and those barriers are many for individuals in our community, including racism and poverty and lack of transportation and other barriers. True is also a new Board of Health member. So for those of you that know, we have a really strong Board of Health in Eau Claire, and True has joined that group as one of our policy board members. We're thrilled that she is joining us today. So we'll be starting with True, and after that, I will introduce our second guest. So go ahead, True.
Thank you for letting me talk about the importance of getting vaccine. I will be saying this in Hmong for my Hmong. So nhớ trong số linh sự tứ của nhớ tư vư của trong xe cơ ở nơi nào của tàu tôn thả cho họ有冇参照 COVID 呀？我是接到 the Black and Brown Women Power Coalition 贴 Power Up Eau Claire bây giờ chỉ còn tên thôi, còn họ mong theo cho nên khu cho mong ở hỗ trợ từ chỉ cần tới trong Eau Claire City Health Department, lo chỉ thà cho họ cảm mong COVID của chúa theo cho chúa nó thì thấy cho cảm mong là một khi đó này có này bảo cho sau sự ôi do theo chính, okay, so nếu nó của lo thà cho chúa thì thấy COVID của chúa thế thà cho tới giờ vì cho chính chính từ bên mùi gió, cho coi thì lúc chỉ hơi nó cho cảm mong nó ní ở chỉ một từ họ yêu là ba bé cho lên từ giờ bây giờ chúng ta là cha chua là thì thái bé từ king họ công chua nó nếu mà đầu họ tới chỉ cho nó ba bé sợ đời giờ ba yêu thì thái yêu từ king yêu chế ninh thì bé dây cho chúng ta là đầu bé lúc tới chờ giờ thầu bây giờ cho như tông tế hình lửa ở bây giờ tao là sinh chỉ tây chỉ mua là mua ở siêu cái của chỉ bảo cho nên đây là mà người của khi mà của anh chơi mua ở siêu đó của cho chính nên là của tây phong như thế sao cái bây giờ nhỏ học sinh nhỏ cái như là bây giờ yêu cho tao sĩ công tế ok mua sát chua cái bây thì thay đó bây tôi kinh theo lực tụ ok cái cho công chua nó na nhưng mà cho là tính là mua sang chua theo sai hệ thì cho công chua nó bổ sung theo lĩnh bỏ tính dùng theo thì thay đó bây tôi kinh tôi là khỏi cảm ơn COVID của chua giờ thầu có muốn nó nhắn để cho họ công chua có tàu chạy có yếu chịu tàu bỏ tiền có yếu tàu chạy ít công chua là ở công chua thì thầu con họ cho công chua nó ta tây rồi có yếu nó mò đi yếu ông bờ mò ít cái là trong này có yếu gì là thì yếu mò được họ có cha chua đấy chỉ có chọn chạy mò còn để chỉ có khi theo hay thì có lúc chỉ yếu bị thì thay cho họ cảm ơn COVID của chua thầu có nó có khó chua ta lời giống mỗi ý đây đỡ kia đó có tiếng con nó cũng chua từ kia con nó bây giờ cũng chua cho giống khơi đại đỡ nó kia có giống sao mà bờ ok cho cũng chua nó do nó đỡ xứ nên giờ chỉ tao thấy đâu nữa ok khi nào nó nên bao thầu nên muốn đi thì chỉ chờ ok lên từ thì tao chạy tao cho cũng chua nó giờ có một cái gì không đó số có những chạy tao cho họ cũng chua ok giờ có một cái đó không có sao nó chua có chạy tao cho visorแต่是嘛你只有知道上的上边照在天有知道的对面有么个也像个到像的木擦错天 họ bây giờ nó yếm mong tàu chờ một nó cho công chua ít khơi chờ ở trong một sát chua giờ tôi tại UWEC Luzon Arena tại xin nó lớn mua cho chua bây giờ thì là khi thầu có yếm mong tàu chờ một trong tu lấy những sao cái này hồ một tình trai một sát chua đó xí mà giờ này họ trả một em cả một họ một sát chua lấy những tàu thì đó xí giờ cho tao một ổn định thầu trong một bây giờ tuần nu Tuesday thứ nu Thursday nó chỉ lấy những mua tôm mong là thay luôn trong này nè okay chỉ tăng lên tới thầu lúa chí lì bằng thi cầu thầu ó mong một trâu trâu mong khởi City Health Departmentอยู่จากการตัวเราก็หอมมองถ้าช่วยเราจะตัวตัวถ้าเราถอดลบล้างหลีเหรอแต่ชียันนี่จะตัวถ้าช่วยนู่นแต่เอ็นนี่เขาจะตัวถ้าช่วยที่อีตัวเขาจะไปถ้าจะช่วยมาเดินนะในเจนี่ตัวเรายิ่งเตาเทียจะยาหูตัวก็หอมมองแต่ใครเราแต่นี่จะตัวถ้าช่วยตัวเขาที่อีแล้วที่นี่ป้องปาเราเนี่ยยันนี่แต่กูจะให้นักแค่จะวัคซีนซื้อยันนี่มันลุ้นอยู่ได้จีนเราให้เราไปเป้าไปมาเรียกแค่เราเนี่ยhồ đầu bé nhau nó chơi này cho lên sự từ và thế chia sẻ hai tiệp bây giờ sinh chi cho nhà tắm đây. Thank you.
Thank you. Thank you so much, True, and thank you for sharing and for bringing your perspective to the table. I really appreciate that. We also have with us today Lidise Montoya, and Lidise is also a strong partner in our vulnerable populations group that I mentioned earlier. Again, we have representatives from across Eau Claire County that have been willing to step in and help us do a better job in reaching a variety of people in this community. So thank you for that as well. Lidise is also an ELCA mission developer for Neighbor to Neighbor Ministry, working with the Hispanic population in this community and many others in the area. So welcome.
Thank you. Hola amigos, soy Lidise Montoya y soy la coordinadora del proyecto Vecino a Vecino Todos Juntos. Y este día quiero hacer un recordatorio y un llamado a toda la comunidad latinoamericana que vivimos en el área de Eau Claire y los alrededores a que nos vacunemos contra el COVID. La vacuna es la única forma en la que podemos volver a la normalidad como la conocíamos, es la única forma en que todo va a ser como antes, vamos a poder estar con nuestros seres queridos y abrazarlos, hemos dejado de verlos por mucho tiempo y vamos a poder estar con ellos sin necesidad de usar ningún tipo de medida de prevención como las mascarillas que son tan incómodas o estar en contacto cercano. También recordemos que con la vacuna nos estamos protegiendo a nosotros mismos y a nuestros seres queridos de las formas más graves del virus del COVID. Si nos vacunamos en estos días, vamos a estar completamente protegidos para cuando inicie el verano y vamos a poder disfrutar aún más nuestras vacaciones que son tan merecidas. Además, recordarles que la vacuna es segura y que hay varios lugares de vacunación en la ciudad, además de los proveedores privados que ya todos conocemos como Prevea, Mayo, Marshfield y Oak Cliff. También el Departamento de Salud ha habilitado un lugar en la Zorn Arena en la Universidad de Eau Claire y a este lugar podemos llegar haciendo citas o sin necesidad de hacer citas. Tienen intérpretes disponibles y además si hay algún problema de movilidad, ellos van hasta su carro a ponerle la vacuna. Así es que nada más reitero el llamado a la comunidad latina a que nos vacunemos. Gracias.
Thank you very much. Again, I think it's always helpful for us in the community to bring lots of perspectives to the table, and I really appreciate both of you for being with us today and for the ongoing work. It's not just a one-time check-in, it's really been a partnership, so thank you for that. So again, lots of need for all of us to be thinking about how we can support one another in the next step forward. So a couple of announcements to share with you. First of all, we're making progress in vaccination. We've now had 81,907 total doses given in out to Eau Claire County residents. So our average doses has been falling in the last number of weeks. Those doses in the last number of weeks has been going down. I think we all have this shared goal of really thinking about how we can keep moving forward. We have vaccine available and we want those doses in arms. 45% of Eau Claire County residents have gotten at least one dose of a vaccine. Again, a reminder that those that are under the age of 16 can't get vaccinated, but anybody 16 and older right now can be vaccinated, and that's important for us. 36.6% have completed the full series, whether it's a 1-dose shot or the 2 doses of Pfizer or Moderna. 83% of 65 and older in Eau Claire County have gotten at least 1 dose. So again, that's good news. The state data does show that our county, as well as across the state, that there are disparities when it comes to race and ethnicity. American Indian, Asian, and Black individuals are not getting vaccinated at the same rate as white people in our community and across the state. People that are Hispanic are also not getting vaccinated at the same rate as non-Hispanic individuals. That's some basic data that we have for our county and we have in our state. I just got off a statewide call that focused entirely on that. And we are also very much caring about making sure that we make opportunities available and don't have those disparities related to race and ethnicity. We're working hard to get information out. We are working with partners like both True and Lise, and we appreciate that. And we need others to get involved in that work with us. We have a lot more work to do, not only on COVID-19, but on all kinds of health issues where we have racial and ethnic gaps. It's an issue that we need to continue to face and work on, and we're really committed to doing that in our health department. Also, a reminder that we have a lot of different opportunities for vaccine clinics, as was shared by our guests as well. Our healthcare providers, our pharmacies are providing vaccines in this community, and those are wonderful resources for all of you if you can link with one of those. On our website, the COVID-19 Eau Claire website, we list vaccine providers and how to connect with each of them. Remember, we are all really working on getting those vaccines in arms. We also are going out to work sites. So we do have many vaccine providers, including the health department, that's going out to work sites and churches and other locations, trying to make it easy for people to say yes to a vaccine. Please take advantage of that. If one of the vaccinators comes to your work site or to another community site where you go, see it as an opportunity to make it easier for you to say yes to a vaccine. And then our Zorn Arena site on the UW Eau Claire campus continues. Our hours are expanding starting on Thursday to 11 a.m. to 7 p.m. So we'll have those 8 hours available for vaccine to be given. It is readily available either as a walk-up ability. You can walk right up and get a vaccine to happen as you are there during those hours, or to make an appointment. And again, an appointment gives you a little quicker through time at the site. So we encourage you to do that. We also encourage you to do that if you have language barriers and need a translator. We provide that no matter what for people, but it certainly helps us in our planning. Or if you have any barriers with being able to easily get out of your vehicle, we make sure that we vaccinate people that need special assistance because of mobility, and it helps us if we know about that in advance. No proof of citizenship is needed at this site. No specific type of ID is needed. So please remember that, and that this is free. All of our vaccine locations are free, and Zorn Arena, there will not be an ask for your health insurance card at Zorn Arena, nor will there be any charge. You come and we will get you through and vaccinated. Parking is very easy. Some people have been worried about UW-Eau Claire and the big campus that is. Parking is across the street. It is a very short walk right into Zorn Arena. So do know there is ample parking, and it is literally across the street. So an encouragement, Pfizer vaccine is available for anybody 16 and older. It is a 2-dose vaccine. It is 3 weeks apart, so please make your appointment or come down for that vaccine. We also, next week, will be having Johnson & Johnson vaccine available at the Zorn Arena site. So next week, Tuesday, Wednesday, and Thursday, first come, first serve. We'll be doing walk-in appointments for Zorn at Zorn Arena during that 11 to 7 timeframe. Last Friday, it was determined by CDC and the national experts that review vaccine safety that Johnson & Johnson was seen as a safe vaccine moving forward. It was put on pause to study that, given that there were a small number of individuals that did have a serious side effect. In looking at the evidence, the national experts decided that the benefits of vaccine far outweighed the risks and recommended continuing. So we are continuing here in Eau Claire at the health department with Johnson & Johnson, as are other vaccinators across the state. It's also recommended that if people have questions, to talk to their healthcare provider and share those risks. And certainly women under the age of 50 are recommended to consider those risks. It's possible, but extremely rare, to develop an issue with blood clots 1 to 2 weeks after vaccination. And that's certainly laid out in the emergency use authorization form that you get if you do receive Johnson & Johnson vaccine. But again, less than 1 person in a million did have that kind of a response, and it's something to pay attention to, but certainly all the vaccines are safe, and we encourage you to get a vaccine that you have available. We've also heard that some people would like to know which vaccine is available at which site. There is some information on the state website about the types of vaccine that are available in the different vaccination locations. We don't keep that on our local website, and it does change rapidly. So when you make an appointment or when you call, you can certainly ask that question about what kind of vaccine is available at that site. Again, we have limited supply of J&J right now, but we will have it at our location at Zorn Arena Tuesday through Thursday, in addition to the Pfizer vaccine that we have there all the time. So also wanting you to know that we are doing, with more vaccine available, some smaller clinics around the community, again, to try and reduce barriers. We'll keep UW-Eau Claire and Zorn Arena running with our FEMA partners and our UW-Eau Claire partners, but we're also doing smaller spots. So you may have noticed we were at Altoona River Prairie Center last week, as well as at Hobbs Ice Arena. In the weeks ahead, we'll be at other locations, including Hmong Mutual Assistance Association, where we're doing a second dose clinic, a couple of work sites, and a couple of other events that we're coordinating with to have vaccine available there. In less than 20 minutes at those locations, you could get a vaccine. So please take advantage of it if you are in those spaces where we have some of these smaller pop-up clinics. Summer is nearly here. The weather today is giving us a little taste of that. And so are the events that all of us love to do in the summer, and we missed doing them, many of them last year. If you get your vaccine in the next week, you can be fully vaccinated by the official start of summer in early June. You don't have to worry about quarantine if you're exposed to a COVID-19 positive person. You can gather with friends and family in a safer way. It's time to get vaccinated, so please find a way to do that. So with that, I'll answer the questions from the media in advance. And then, as I said, we will have time for questions from the media after that for myself or for True, our Lidice as well. So first of all, if someone is a permanent resident here, but winters in another state and got vaccinated there, do they need to report their vaccination to their provider locally when they move home? We encourage everybody to make sure your local healthcare provider has your full vaccination record. So absolutely, if you got vaccinated elsewhere, make sure that your local provider does have that information. If you happen to get a vaccine in Wisconsin, it will be in the Wisconsin Immunization Registry. It also can be added to the Wisconsin Immunization Registry if you received a vaccination elsewhere. Do hold on to your vaccine card. That really is your document that is your evidence of being vaccinated. If you're vaccinated in Wisconsin, you can also get a printout from the Wisconsin Immunization Registry easily, and we have information available on how to do that. We also have a question about, is it true that people who've had COVID have stronger or more significant side effects to the COVID vaccine? Some people have been known to delay getting a vaccine because they're worried, is what the question is. So I will tell you that it's very variable what kind of side effects people have related to the vaccine they receive. It's still being studied. There is not clear evidence of a specific connection between having COVID-19 previously and any specific type of response that is heightened because of that. We are certainly hearing about it anecdotally, absolutely. There is no reason to delay getting vaccinated. There are many people that have had COVID-19 that get vaccinated and have absolutely no enhanced or additional stronger side effects for that 24 hours after vaccine. We do sometimes hear about it. You should plan ahead for having some symptoms. It means that you are getting a response, and that's what we want with a vaccine, that your body is preparing for being exposed and having a good response to that. There are plenty of people that have not had a significant response that is heightened because of disease, though. So it is something we're watching. We don't have clear evidence that there is a connection. It's important to remember that vaccine is needed for everybody. If you've had COVID-19, it doesn't mean that you should say, I don't need a vaccine. Research is really showing us that the vaccine gives stronger and better immunity than getting COVID-19 alone gives us. We have data that the vaccine is effective against variant strains, and we don't have that data yet about natural immunity from having COVID-19, a positive case of that. So there's no need to wait. It's really important to still get vaccinated, even if you've had COVID-19 and fully recovered. And there's every reason to get it done. It certainly, with a vaccine, means that you don't have to quarantine if you're exposed in the future. Also asked is, why doesn't Eau Claire have a drive-through clinic? Some locations have done a drive-through clinic for COVID-19. We in Eau Claire don't have that in place right now. We've done some small examples of that. In Augusta, we did a drive-through clinic because we had the facility that was able to support that, and we certainly would do that again in Augusta if that was needed. We have lots of options for getting vaccinated, and it goes very, very quickly in our location where we are at Zorn Arena and in the other pop-up locations. In our community, we don't have an easy drive-through location to make that happen, where we can have all the appropriate precautions and safety pieces in place in the space for drive-through that is needed. We want people to be safe with this vaccine. We have a 15-minute at least period of time where we're observing people, and it's been workable for us to do that in an indoor setting. We take that seriously, and we're getting vaccine into arms in a quick way with the model that we have. If you have trouble getting out of your vehicle, again, a reminder that we do have provisions to make sure that we can make that happen at Zorn Arena. So let us know in advance. or let someone know when you arrive at the location that you need assistance with having that type of service come to your vehicle. And we have ways to make that happen. So don't worry about it if you need that accommodation of not getting out of your car because of significant mobility issues. We'll make that work. We also were asked about our Amish and Mennonite population and whether we're struggling to get them vaccinated. Where does Eau Claire stand with that? We don't have a specific way to track our Amish or Mennonite population in our data, but we do know we have challenges with vaccines in general with those populations, and we work hard to connect with them on all types of vaccination. Our public health nurse team has long worked with the Amish and Mennonite populations on the eastern side of our county on those issues. We've also worked with providers in the Augusta area and held clinics in the Augusta area where many Amish and Mennonite families live to make it easy to get vaccine and to be vaccinated from some trusted providers. So we do work on partnering with those groups as well. Finally, we have a regional effort that is just starting now to develop shared messages for some of the more vulnerable populations in our region and populations that may have barriers, including a specific focus on Amish and Mennonite communities in the region. We certainly have counties surrounding us that also have an Amish and Mennonite population with shared interest in that. So we'll be working with them on that regional effort in the weeks and months ahead. We also have a question about places around the country announcing that they're lifting COVID safety restrictions soon, and a specific question about what would it take to end Eau Claire County and City of Eau Claire mask mandate. The mask ordinance is an ordinance that was put in place by the City Council and the County Board. It is in place until June 30th and would only be changed by a City Council or a County Board vote. We still have spread of COVID-19. We still have very strong recommendations from the Centers for Disease Control federally and from the state, as well as from our department, that the best practice right now is to continue to wear a cloth face covering indoors and when you are gathering in larger groups. Our face mask ordinance is specifically focused on those indoor settings where multiple people are together. So important. The CDC came out this week with updated guidance around face covering use, and again continues to support the use in indoor settings, which is what our face covering ordinance really is tied to. If people continue to be concerned about wearing face coverings, and I understand that there is that concern, get vaccinated. The quicker we can be done with this, the better. So it's another really strong reason to get a vaccination as quickly as possible. We also had a final question about COVID-19 cases and people after they've been vaccinated. Again, our number is very low of those cases. We have been starting to track them. The state and the CDC is watching that. And as we learn more from the state and CDC about what they are seeing with those cases of COVID-19 that happen post-vaccination, we'll be sharing more. So with that, Audrey, do we have any other questions that have been posted?
No questions have come in through the chat box. Would any of our media partners like to unmute and ask any questions directly?
Yeah, Lisa, this is Sarah Seifert from the Leader Telegram. Can you hear me? Awesome. Yeah, I just wanted to follow up a little bit on that last question for these so-called breakthrough infections, which sometimes happen in people who have been fully vaccinated. Can you speak to should people be concerned about breakthrough infections? Is this an indicator that the vaccine isn't working? Is it an indicator that it is working? Can you just speak a little more about that?
Sure. Again, very, very, very small numbers of breakthrough infections that we are seeing in Eau Claire and across the state. So very small numbers. not unexpected. Certainly no vaccine is 100% effective, even though this vaccine is much, much more effective than many that we have available to us, that we have all the time in our vaccine world. So no vaccine is 100% effective. We have very, very small numbers of breakthrough infection. And what we're seeing to date, at least more locally, is that it typically is a much less significant of an infection with those breakthrough infections. So it's doing its job. This vaccine was originally seen as very effective against hospitalization and death, and we are not seeing that kind of impact with people that have been vaccinated. We still have hospitalizations and deaths with people that have not been vaccinated. And it again is a vaccine that's really making a difference in hospitalizations and deaths. And really what we are seeing to date, again, with the very small numbers we have, with very minimally impactful disease. So it's not a failure of the vaccine. It is in fact working. And yes, we are tracking, like we do all vaccines, to see what is happening, and it's being studied, but definitely not anything unexpected with the very small numbers we're having, and not a reason to think that there's a problem with the vaccine. We are seeing really, really good results in our data with lessening cases and with much less hospitalization and death. Any other questions? All right. With that, I will say thank you. I'll especially thank my partners who were willing to come on this call with us. So thank you to both of you for sharing your perspective and being willing to join our time here, but also, I guess, really more importantly to me, to be a partner in our work together. I hope that goes long beyond COVID-19. So I am counting on that. And thanks for everybody that joined us today. Do go to the COVID-19eauklar.org website to get more information. You can also always call the call center. That's 715-831-7425 if you have questions that are not answered on the website. Next week, we'll have a briefing on Thursday, May 6th, the first week of May. It will be our last regularly scheduled Thursday briefing. We will continue to do briefings as needed after that point if there's something specifically important to bring everybody together, and will be available for media as usual as a health department. So you can certainly reach out to us. But next week will be our last planned 3:30 Thursday briefing. We'll update our website and social media regularly, and we'll talk more about that next week. So thank you, everyone, and have a good rest of your